We're going to start tonight with what the National Registry calls TEI questions, probably better identified as multiple response items. And I think it's important that we go through these and talk about these because you will see these on the National Registry exam. And I also believe that these are just great to build critical thinking and knowledge from, quite frankly. There we go. Let me know which three of those you believe may be seen after the administration of nitroglycerin. These take a little bit longer than traditional single response items. All right, let's take a look at this. Choose three of the following 5 effects that may be seen after the administration of nitroglycerin. All right, so we have consensus on a couple of these. We have a consensus from the group that it's normal, that it's we may see hypotension, and I agree with that, and headache is the other one. Now we have a little bit of an issue in the others. Now the correct answer here is decreased preload. And why is that? Because nitroglycerin causes vasodilation, which would actually decrease vascular tone. And that we wouldn't have coronary artery vasoconstriction. And while there's kind of a misnomer, a misconception out there that nitroglycerin is designed to dilate coronary arteries, it's really not. What nitroglycerin does is it reduces the workload of the heart. It pulls a little bit of blood peripherally, reduces preload, reduces the workload of the heart. Headache is a common side effect. Hypotension is a side effect that we don't want. And decreased preload is one that we do want because it reduces the workload of the heart. We do vasoconstriction throughout the body, a little bit of blood pooling out there, and that's why we see what we see. So when you see these kind of questions, and there's 3, many times you get a couple right off the bat, you say, okay, yeah, these are really it. Then you've got to look at these and say, all right, well, which ones are wrong? Because the National Registry chooses things that can sound good, like, well, it could affect vascular tone, but does it increase or decrease vascular tone? And coronary artery vasoconstriction would make blood supply to cardiac tissue worse. Now, what I'd like you to do, let me know what level you are preparing for, EMT, AEMT, or paramedic. I have a couple of ALS questions in these TEIs, just in case I have anybody doing AEMT or paramedic here. All right, take a look. If you get these on the National Registry, they will count towards your score, all right? And it's important to know that, and it's important to also know that you have to get all of them correct. There is no partial credit on this on the National Registry exam. You have to get all of the choices correct. There's a lot of thinking involved in this, and I'd expect you to take your time on the National Registry. So choose 2 of the 5 things you would see as side effects of albuterol. Well, the correct answer is tachycardia and tremors. Now remember that these 2 things are the answer for several reasons. One, it's because it's part of the sympathetic nervous system, part of our fight or flight. And while albuterol may be beta-2 specific, there's always the potential for crossover into beta-1, which would give us that tachycardia. That could also give us muscle tremors, but the interesting thing about beta-2 is that beta-2 also has a little effect on the skeletal muscle because it's sent to the skeletal muscle to help release glycogen and as part of our fight or flight. And that's the other reason the tremors may be there. Since this is a beta drug in our sympathetic nervous system, Lethargy is not so much likely. And what we do is we actually cause smooth muscle dilation, especially in our small bronchioles. So it's not constriction, it's dilation that we want in that smooth muscle that wraps around our terminal bronchioles. Then carpal pedal spasms are generally something that we see when a patient severely hypoventilates and gets into an alkalotic state. So the correct answer here is tachycardia and tremors. For any else EMTs, you can certainly try this, but I think it's interesting in this. It's important that we think about what we need to do when we get a code, whether we're an advanced provider or a BLS provider. There are certain priorities which are unique to both groups, and that's one of the reasons I chose this question. The longer a code goes and the more interventions that are done, the less likely the patient's going to survive. And I think that certainly is noteworthy and shows the importance of BLS for everyone. If you go through and we have a test for each section of the National Registry, and anytime you go through and you get a question wrong, I always want you to read the rationale and then go back to the question and say, what did I miss in that question that would have helped me get it right? Even tonight, while we did this, I think you might be able to fit one or two more of these sessions in. I recommend them, but we do have these recorded sessions available for you in the webinar section at emtreview.com. So, if you get a question wrong, don't just say, oh man, I got it wrong, and move on. Figure out why, because that will help you read the question in the future. And then I'd say the most important thing is, study, be ready, keep your head about you. I don't know if anybody totally feels ready going in, but take good questions like we offer you here, stop by office hours again, and then just focus your study when you do questions from emtreview.com. If you go through a question like, oh wow, I don't think I was ever taught this doesn't make any sense, then look that up, right? But if you go through to get a bunch right and say, well, I'm really nailing cardiac, okay, move on to something else. I think those are the best things that I can do. Yeah, I think that's it. And as always, please drop me a note. Let me know how you're doing doing this. But I think you can at least fit one of these in. And if you can't, we do have some recorded ones there. So I'm going to wish you the best. I hope I see you at the next session. Take great care, and I'll see you soon.